Okay, hi everybody. It's 1 o'clock, so I think we're going to get started. Again, if you're having technical issues, if you can't hear, to please just send a question in the questions section and we can help to troubleshoot that. So we'll do introductions in just a second, but I just wanted to do the kind of the brief overview and to let you know that I will be sharing the slides on the screen here, but they're also available for you to look at either now or later through this bit.ly link, which is on the screen. And as well, that link is also listed in the chat, which you should have seen when you first logged in. So the session today is part of our researcher workshop series, and it's one of the first times we've offered this online. So hopefully that it all goes okay. We're learning along with you guys. And what this session really focuses on is the various types of reviews. So I think we're all familiar, or many of us are, depending on our discipline, with what a systematic review is, even if we don't kind of understand all the different elements that go into completing one. And systematic reviews are always kind of in high demand, but there's a lot of other review types that can be just as helpful and in some cases a lot more appropriate to the kind of question that you're having. So today we're kind of going to explore that a little bit more. And so my name is Malin Lay, and I'm one of the health sciences librarian. And today I will be doing part of the session, and my colleague Janet will also be doing the session. So let me just go through here on the slides. So just to introduce myself a little bit more, and Janet can also introduce herself, is I've been a librarian at the Neil John Maclean Health Sciences Library for about 10 years and have been involved in a lot of different what are called knowledge synthesis products. So that includes systematic reviews, but I've also been involved in rapid reviews and scoping reviews, which by the end of the session, hopefully you'll learn a lot more about, and I'll let Janet introduce herself too.
Hi everybody, I'm Janet Rothney. I'm also a health sciences librarian, normally at NJM. We're all at home these days, of course. I've been a health librarian for about 10 years as well, and lots of experience with systematic reviews and scoping reviews. Those have been my primary places. And then we also do a lot of teaching or guiding with students and residents and stuff like that. So fairly familiar with the health sciences aspect of this. It sounds like there may be a bunch of people who are attending today who aren't from Bannatyne campus. So bear with us. We have a definite health focus, but hopefully you'll find some of this stuff useful as well.
And so just it's written up on the screen, but just to restate for the webinar today is that we are recording it, and we're hopeful that we will be able to post it onto our website, because we know that there's a lot of interest in this topic, and that any of the chat or questions that come out of this, they will not be included. It will just be kind of the talking parts. So don't be worried about that. And again, technical issues, you can send that to us, to just the organizers in the question field. And if you have a specific question while either Janet or I are speaking, to just go ahead and enter that into the question box. And you know, if it's of a non-technical nature, feel free to just send it to the whole group, because chances are if you have a question, somebody else does as well. So then we can just kind of share the information with everybody. And sorry, I'm working between 3 different screens here, so sometimes I have to remember to click kind of all the different things. So as I said, this session today, we're going to push kind of beyond just what a systematic review is, and we're going to focus on learning about what some of the advantages and challenges are of the different review types. So not only kind of what is a scoping review, for example, but what are some of the good things and the bad things about that as well. And hopefully you'll be able to use that information to really determine which type of review might work best for your specific research question, how much time you have to do it, how many people you might have on your team. So there's a lot of different kind of factors you want to take into consideration when you're picking a review type. And what we're going to do is we're going to describe why reviews are necessary, And the text here says health sciences, and part of the reason is that, you know, systematic reviews really started in the health sciences, and they have they're very well established, but they are growing more and more into all the other fields. So you could make the argument that reviews are necessary in pretty much all fields, and I think we're going to be talking about that today. It's not just the health sciences. We're going to compare and contrast these different review types, and we're going to show you some basic ways that you can search the literature to find different review types, so that you can see, well, if I did want to do a rapid review or an umbrella review, what would that look like in my specific area, and how would I find one? So I thought what we would just do is we would do a quick poll. So I'm going to start a poll here, just to get a sense of people's familiarity with different types of polls. So if you could go ahead and select one, or any of them, if you've read any of these types before. I'll just give it a few seconds more while people vote. Okay, so I'm going to go ahead, just give you people maybe 10 more seconds, and then I'll go ahead and close the poll. Okay, so let's take a look at these results. So basically, kind of, we just wanted to gauge people's familiarity with different types of reviews, and this kind of aligns with what we were kind of thinking, is that most people have familiarity with systematic reviews and meta-analyses. Meta-analyses are often built into a systematic review, and people are getting more and more familiar with scoping reviews. They're becoming more popular. And I'm glad that people are familiar with more the qualitative side as well, and just some people who maybe aren't familiar with any of them. So hopefully by the end of this, you'll be a little bit more familiar, and then we'll want to go read all the different kinds too. So let's hide that. Okay. So why do we do reviews in the first place? And really what you're doing when you're doing a review, no matter what kind it is that you're trying to summarize knowledge around a specific question. And one of the reasons it became popular in healthcare specifically is that you want to be able to make evidence-based recommendations that are pulling from the evidence, pulling from the literature to support decisions. So kind of not always doing things just because that's the way they've always been done. So reviews can also really help highlight gaps in knowledge. So you can see, where do we need to do more research, or where do we not have enough information to really make a recommendation. And so really the most common kind of approach when doing a review is that you're summarizing, interpreting, making recommendations. And really a lot of them started with having a very kind of traditional clinical question that they were trying to answer, and then following these steps to come up with the review. And all of the review types that we're looking at today, they all follow kind of very explicit, pre-described and reproducible methodology for this whole process, because they're all about trying to limit bias by having very clear methodology in how they did these kind of 3 steps. And so there's a lot of different kind of evaluation and summarizing, and really what happens when you do a big review of something is that you increase kind of the weight of it. So as opposed to using, say, a single study that and its findings to make recommendations that looked at, 10 people, when you're kind of summarizing and synthesizing and putting that together, the power increases if you, say, have 100 people now or 1,000 people. So it's really about increasing the strength of the recommendations that you're making. So this presentation today, it's really pulling from one kind of key article that came out in 2009. So we've linked to both of them here if you do want to go in and kind of look through more thoroughly, if there's a specific review that kind of jumped out at you. that you think would be applicable. So the first one that came out in 2009, what it did is it looked through stats and it pulled from the literature to come up with 14 different review types, and it talked about the methodology associated with them. So that was kind of one of those key pieces in the field, and it really guided how a lot of people looked at reviews since then. So that came out in 2009. And then the authors did an update that came out just last year that looked at, again, they did kind of broad searches to see what kind of reviews are people doing in the field. And from that, what they did is they identified 48 different review types, and they grouped those into 7 different families. So really, there is a review type out there kind of almost for any kind of question that you may have. So this presentation is really going to delve into those. Okay. So it really is just more than systematic, and I think you've kind of heard me throw out some of these terms already. And we're going to be looking at the ones in red here, and I think one more as well, because these are really the key ones that people talk about. And we might briefly touch on some of them, but know that these are kind of some of the key ones that are discussed. And I briefly just want to talk about the difference between kind of what we call kind of big S systematic reviews and kind of this little s systematic. So basically, there has been over the last couple of years this move towards greater transparency in how people do reviews. So you don't have to do a systematic review for every kind of question, but what you do want to consider is whether you do want to make the methods that you use or how the process is done, whether you want to make that kind of more systematic. And what I mean by that is more transparent, reproducible in how these reviews are done. So I think it captures it well, is that like all reviews don't need to be systematic, but they should follow kind of a system of inquiry that is systematic, so that you're always kind of doing the same thing. And again, it all comes back to how do you increase transparency and how do you reduce bias when you're doing a review. Because if you do a review of literature and you only kind of pick the articles to include that you already know about, well, that's bias right there, because you're just kind of reviewing things that are in your specific field. You might not be as open to articles that may present a different view of your own. So even if you end up not doing a specific kind of big review like we talk about today, is that you do want to still include different, this more systematic kind of methodology when you're doing your search to reduce that bias. So what we thought it would be kind of interesting to do is that there are different tools out there to help you decide what kind of review might be right for you. So what I thought I would do is get everyone to kind of go through one of the tools here, one of the ones that we have created in-house. And whether you have a project in mind already, or you just kind of want to come up with the characteristics for a review that you might be interested in, and then just to see what review people end up with. So I'm going to run that poll as well. The link is this SurveyMonkey one right here, but I also have the poll linked here as well. So just a kind of a slightly more straightforward link. So it's bit.ly/NJM tool. And I'll give you about 2 minutes to go through that and answer the questions, and then pick which review type you ended up with based on kind of either a project that you're thinking about doing or a made-up project. Okay, so I'll give it maybe about 20 more seconds. I know this one's a little bit more involved. Okay, so I'm going to close the poll shortly, but again, these slides are available for you. This tool exists on our webpage and it's also linked to here, as well as the other one that's linked here is a bit more, it asks even more questions, so you can really kind of dive in a little bit more if you want to see kind of what review type might be most appropriate for you. So I'm going to close the poll, share those results. So the majority of you sounds like a standard lit review might be in your future. And that's kind of, again, what we're most familiar with is, and a lot of the reason probably why a standard lit review was suggested for you has to do with how much time you have and how many people are on your team. So we'll get into that a little bit more. And some people, rapid reviews are faster ones, and some scoping reviews too. So, you know, if this tool suggested a review type to you that you weren't familiar with, then you'll kind of know that maybe you want to pay extra attention during that point of the talk. So hide those. Okay, so I'm going to hand the slides off to Janet at this point, who's then going to talk to you about these different review families and go through some of the specific review types within each family.
Okay, just give me 2 seconds to get myself organized here. All right, so, oh, wait, hang on. There we go. Okay, so here's our 7 review families, and these come from that the Sutton paper, the second paper that we linked to from the Grant and Booth projects. And we're just going to go through all 7 with a few examples. So the first one is a traditional review family. This is probably something that would be familiar to you from like an undergrad scenario, or maybe if you have done reviews or read reviews for a long time, this used to be how everything was, right? A narrative review. So a literature review illustrates what knowledge and ideas have been established on a particular
Janet,
topic.
sorry to interrupt. We're just hearing, people cannot see your slides. They're just seeing you.
Oh, just seeing me, huh? Okay, hang on. Thank you for letting me know. Share my slides. Oh, I gotta change my presenter. And share my slides. And then I have to do this fancy dance with Google. Okay, how's that?
That looks good for me. Let me know, people in this chat, if you can't see it.
Okay, so I'm gonna keep talking and Malin will shout at me if you guys still can't see my slides. So basically what is happening in a traditional review is that there will be a description, a summary, and evaluation of each study or each sort of theme inside of the studies. Analysis might be conceptual, chronological, thematic, something like that. Doesn't always.
Sorry, Janet, sorry. We're
Okay.
still not, it's gone pitch dark now.
Huh. Okay, so maybe what I'm gonna do is just show you them from here.
Sure, and you can do that. I can see that.
Yeah.
Again, people can let me know if that's not clear enough in the thing.
And you guys can feel free to follow along on your own if you opened up the slides from your own computers too, right?
Okay, yeah, people are saying that works fine for them now.
That works fine. Okay, great. Thanks, everybody. So let's keep going with this, talking about traditional review families. So there's some strengths and weaknesses, obviously, for all of these types of tools. The strength of a traditional review family is that it's less formal and builds on previous work. Basically, the point of them is to identify what's been done already and what needs to be done. There is definitely some bias issues with a traditional review type, and that's really why things have moved away in large part from traditional reviews, except in some certain circumstances that we're going to talk about in just a sec, that make this still a valuable tool. So one example is a state-of-the-art review, and if you are there's lots of journals that have sort of a column that's like a state-of-the-art review. So BMJ has one where they basically pick a certain topic for each issue of their journal, and someone will kind of give an overview of what's happening, right? So there's a BMJ picture on there, and really looking at what's happening, what's new, what might be upcoming in terms of what kind of research needs to happen. So a call out is quite common in a state-of-the-art review. Now moving into maybe what you were expecting to hear about today, the systematic review family. So this is some of the more common work that we talk about when we're talking about systematic searches. There are lots of different kinds of systematic reviews. So the Sutton paper talks about diagnostic test accuracy reviews, meta-analyses, prognostic reviews, systematic. All of those kind of fall into the same place, right? One thing that may not be familiar to you on the slide there is the concept of gray literature. So I just wrote out a little definition. Basically, it's unpublished works. So that can vary depending on the subject you're working in, but often conference abstracts, position papers, government reports, that kind of thing falls into gray literature. And it is often not collected in the same databases where we look at articles. So you may need to have some different retrieval methods to gather that kind of information, and often you need some subject expertise to know where to look for that stuff. So as a librarian, I often will need more advice from my researchers on where to look to gather the gray literature from a systematic review project. Kind of a subset of systematic reviews is a meta-analyses. You can kind of have a systematic review that doesn't have a meta-analysis, but you can't really have a meta-analysis that doesn't have a systematic review attached to it, right? So statistically, combining quantitative studies is what a meta-analysis does. It started in the social sciences and really requires a lot of homogeneity in the work that's being done. It has to be similar enough to pool in order for it to make any sense to do that. So often you'll see projects that intend to do a meta-analysis but end up not being able to because there isn't similar enough data. Strengths and weaknesses here again, it is a very strong indicator of evidence value to be able to find a meta-analysis. Really, you kind of have the answer to your question in more than one way, right? You have that conceptual yes or no, this is something that's working, but also you have pooled data from multiple studies. It is a complicated process. It takes some time. It takes more expertise. You probably need an analyst to be on your team. And really the strength of the meta-analysis is hinging on that, on the primary study strength, right? Systematic review overview. Sorry, I'm getting stuck on my notes and my slides, just like Maylin was saying. So a systematic review has a systematic search, an appraisal, and a synthesis of evidence of some kind. As we mentioned, sometimes has a meta-analysis, but not always. And true systematic reviews, so again, this gets back to that big S, little s kind of concept that we talk about at NJM is a true systematic review is adhering to a guideline. So something like the Cochrane collaboration, the Joanna Briggs groups, something that has a setup that's published and easy to find, and is really aiming to be transparent. So looking at reproducibility, reporting on where the studies come from, what you do with them, where your choices are, all of those kinds of things. There is a wide variety of quality of published systematic reviews. So journals seem to make their own choices about what is and is not a legitimate format for systematic reviews. And it really also depends on your field, how much information is out there on evidence-based practice. So there are lots of published systematic reviews that aren't amazing. Let's just say that. So the whole garbage in, garbage out idea really does suit this field, absolutely. And we obviously as librarians are a little focused on the search because that's usually the part that we work on and is our expertise. But it does, so we're not saying that it's the be all and end all of a systematic review process, but it really does drive where you go with the research, right? Because if you're not gathering enough information or the right information, or if you're missing big chunks of information in your systematic review, your results aren't going to be as impactful, right? So there's some strengths and weaknesses on the screen there. Bringing together all known knowledge is really the aim of a systematic review process. And one of the weaknesses is that it's quite time consuming, and ideally you have a number of people on your team, which may or may not be easy to do. Usually a systematic review has quite a tight question. Often it's a clinical question, and generally we're looking to limit to a specific type of article. So a randomized control trial is sort of the classic systematic review. So if your research doesn't fit into that really tight little box, your systematic review is either going to be harder to do or kind of come up with a not as tight of an answer, really. So when we're talking about systematic reviews, it's a nice little quote from the Grant and Booth article. So this is basically what the aim of a systematic review is: gathering research, getting rid of rubbish, and summarizing the best of what remains. And in theory, if you read one systematic review, it's sort of like reading all of the primary studies, right, that are included in there. So you're really cutting down on the amount of literature you have to sift through yourself and make decisions about. Okay, reviews of reviews. So this is kind of building on now, once there were enough systematic reviews to be a little overwhelming, which happened a while back already, this review of reviews families started to crop up. So sometimes they're just called reviews of reviews, sometimes they're called umbrella reviews, and really they're focusing on one study type. So just like with systematic reviews looking at only randomized trials or maybe cohort studies, the review of reviews wants to keep comparing the same types of information as well. There is definitely a focus on the databases that index systematic reviews. So near the end of this session, we're going to talk about how to find systematic reviews, and some databases are built to do that better than others. So if you don't have that function in your subject specialty area of in your favorite database, it may be hard to do an umbrella review because how do you find them in the first place, right? I think all of the rest of that is sort of a similar idea. Let's talk about where these things come up. So really, again, if we're looking at when can you do an umbrella review, you're looking for lots of information and lots of that second tier information. So you can't use primary studies in an umbrella review. That's not the point of them. So you need to have a mass in your question of systematic reviews or meta-analyses to gather together. It is quite nice as a reader to find an umbrella review in your area because, again, then you're synthesizing even further a large pool of information so that you can get a sense of what's happening in your area by reading one paper instead of 25. So there's an example from the Lancet. Okay. Let's talk about rapid reviews. This is something that the COVID-19 situation has really brought some of this work to the forefront. Time is of the essence. We saw this also with the Ebola crisis a couple of years ago, that information needed to get into the hands of clinicians very quickly. And one way to do that is with an accelerated systematic review process. So the idea is to be quick but not dirty. It can be tough to make the right choices to make your rapid review actually rapid. But essentially what you're looking at is having a tighter question, doing a simpler search, but just being as transparent as possible. So maybe you search in fewer databases, or you limit by like a year, which is really uncommon in systematic searches. Again, looking at reviews of reviews can be rapid, and also looking at a simpler quality appraisal process. So you're not necessarily doing a whole involved process to look at how well the papers that are coming into your review are graded, and more about synthesizing some literature to get out to the field. One really important feature of rapid reviews or rapid evidence assessments, all of the rapid review family, is that there is still an expectation that you're as transparent as possible. So writing out your methodology about which choices you're making to make this rapid is really important. So a discussion of the limitations in your conclusion is pretty critical in this family. So it's also quite common in policy to do a rapid evidence assessment sort of on the continuum. So in this slide, we've got the amount of time that something might take, and then also how much confidence you have in that type of paper, right? So a rapid review is maybe better than a narrative review in terms of confidence. You can trust what's happening in there, partly because you can see what's going on. You have that transparency of the search processes, but it's not going to take as much time as a full systematic review. Strengths and weaknesses, I think these are probably fairly inherent, but it's still systematic and it takes less time. There is a greater chance of bias, and the appraisal is usually limited. That's usually not the focus of a rapid review. It's more about some general synthesizing of the literature. It is not a substitute for systematic reviews, and they're not usually done as a first step to a systematic process, unless it's something like this COVID situation where we need information today that we didn't need yesterday, and then in a month from now we might be ready to do a little bit more of a broad systematic search. That's sort of an unusual scenario. Let's hope that stays unusual. So rapid reviews may be something that we see a fair bit of in the next 6 months or so, more than we have in the past. There's also, I know I've been involved in a number of papers that started with the idea of being rapid reviews, and then just because of the nature of the question, didn't end up being all that rapid, right? So that can be a bit of a pitfall if you're not really focused on what you need. Qualitative systematic reviews. So now we're getting into some of the broader definitions and maybe a little less health focused, although there's definitely qualitative literature in health, of course. So there's not as much, I would say there's not as many rules yet for qualitative systematic reviews. So things are a little looser here, partly because the literature in qualitative work is a little less similar to each other, right? So you have to figure out how to bring it together in a slightly different way. But they can be used to explore barriers and facilitators to the delivery and uptake of services, so healthcare or other kinds of services. Qualitative reviews can be used to investigate the perceptions of a new role in a system, or from the point of view or of either those filling the role or those who that hold the post holder interacts. So for example, when there's a sort of a new rank inside of a healthcare system. So physician assistants, how do we use them? How do people want to interact with them? Those kinds of things, and how are different systems employing this new role can really help bring that. If you bring that literature together, it can really get some things moving in terms of sharing ideas, right? Sometimes qualitative systematic reviews are called qualitative evidence syntheses because that systematic review word has become sort of a quantitatively focused concept. So the qualitative folks who are all very qualitative may not want to adopt that terminology. So an evidence synthesis and a systematic review are really can be quite similar in terms of the families anyway. So strengths and weaknesses of these guys, there's a lot of use in exploring barriers and facilitators for new services or roles, informing prioritization of those services, and it complements the research evidence with user-reported and practitioner-observed considerations. So often you kind of want a little bit of both, right? And we're going to get into mixed methods in a minute. So sometimes one paper has both concepts in it at the same time. The weaknesses of qualitative systematic reviews are really just that they're newer than the other sets. So not necessarily a weakness per se, but there needs to be some more development done in terms of standardizing methodology and figuring out what can be done in this field. Okay, so I alluded to this already. Next one is mixed methods. So there's a number of different types of papers within this group. And obviously we're looking at combining different types of literature. It does usually contain a systematic search, and you'll see some Prisma reporting and that kind of thing in terms of the quantitative side of things, and then qualitative research as well. So sometimes there's a theme section and then a data section, that sort of thing. Personally, this is where I have the least amount of familiarity, and that just might reflect what's happening in health so much. There's been a little bit, it's either quantitative or qualitative. There's less mixed methods, and I think there's some strengths to be looked at in terms of from other areas for the health folks. So I'm curious. I hope some of you guys on the call may have some information or some experience with mixed method searches. I am eager to hear a little bit about that. So talking about strengths and weaknesses, obviously it's great if you have a mixed method study to get those two perspectives in the same place, right? It's really efficient for people making decisions. Again, weaknesses are about how do we combine this kind of information? How do we integrate different types of data? I think this is fairly standard for most mixed methods questions, right? Any kind of mixed methods research. Okay, and getting near the end of our types of families. So purpose-specific family, these are kind of, they are all purpose-specific, but it's a concept analysis is quite different than a scoping review, so it's a little bit less of a tight family, I guess you could say. So a number of different kinds of things fall into this group according to the Sutton paper. And there are many different guidelines for each of those review paper types. So a methodological review and a concept analysis may do completely different things. Their structure might be quite different, but they are all pointing at one specific purpose, right? Hopefully that makes a little bit of sense. So let's talk about one of them that we see fairly often at Bannatyne anyway. Scoping reviews are quite common now and do perform a different function than systematic reviews. So generally they're looking at either providing a preliminary assessment of the potential size and scope of the literature. So if there's quite a broad area of literature that has never had a systematic review aimed at it, a scoping review can kind of get a sense of what's out there and where those questions should be focused. The other quite common use of a scoping review, and most of my scoping review projects have used this definition, is to look at the nature and extent of research literature on a topic. One of the primary methodology papers for scoping reviews is Arksey and O'Malley. There's a number of kind of add-on pieces as well, but that's the original framework and still very much in play. Strengths and weaknesses, again. So a strength is that they're quite, even though a scoping review question feels much broader than a systematic review question, so a systematic review question might be, does X drug versus Y drug result in improved outcomes for patients? Whereas a scoping review question might be something like, what is the experience of healthcare practitioners in pandemic situations? So the questions are still quite focused and you answer them in a very systematic search type way, but sometimes your search methods are quicker because you're looking at a broader scope. The screening phase of a scoping review can take quite a bit longer because you're looking at a broader swath of information, right? And trying to figure out what to do with that information, how to thematically sort it, can take a little bit of time. There is the potential of bias in scoping reviews because the search can be a little more iterative. You may not know what's out there in the way that you would with a systematic review. And it's quite easy to make a bad question for scoping reviews. So even my example question would probably not be a very good scoping paper question. So it does take a little bit of time to sort of get into the right headspace for a scoping review question. So there's a little bit of terminology issue as well in the systematic review kind of field or the systematic search kind of field. So here's just a image from the Sutton paper that talks about some of the more common mismatches. So they're trying to differentiate and build on, so if we all start using the same words, there will be a better differentiation between, say, a scoping review and a mapping review. And that is not necessarily the case in literature these days. So consider what words you think of when you think of a scoping review versus a mapping review, and pay attention to what your field is doing in terms of definitions and what terminology is used and maybe what isn't. And I think that's something that will continue to change, but hopefully solidify a little bit as we move forward into further new types of systematic reviews or systematic searches. Okay, so should we pause for questions maybe just before we'll go into the next section about finding reviews? Malin, do you have any questions?
I have no questions.
Okay.
I mean, from the audience.
Okay, I have a couple of, okay, I'm just looking through the questions and most of them are about now being able to see my screen. Thank you everybody for sharing that. And okay, so I think what we'll do is pass off to Maylin again, and she's going to talk about how to find reviews.
Okay, so I'm just, gonna try and share my screen again. Let's see if I can do it properly. Maybe not. Sorry, guys.
I think I just made you a presenter.
There we go. Okay, thanks. Okay, so you should be able to see my types of reviews. Let me just actually bring it up one more time. Okay. Oh, and I'm just going to advance because I am still stuck on that page. Thanks everyone for your patience as we figured this out. So can everyone see me quickly skimming through these slides here? We're all at least seeing my slides. Okay. So I'm going to talk a little bit about how to find reviews. And as we've talked about, it really kind of varies based on, sorry, I'm going to bring all this stuff up. I have it like a slow reveal, but I like to just bring it all up. It really depends on what your field is and what database you're using. So Janet was talking about your favorite database and how it works. So in health, because because the different types of reviews are pretty well established, most of our databases have kind of a button you can click that will help you narrow it down specifically to different review types. So I thought I would show this to you in PubMed just so you could kind of see what it was looking like. So I'm going to move this out of the way, and hopefully you should be able to see this PubMed screen. I can see it showing there. So if any of you aren't familiar with health, PubMed is our big database in biomedicine. It's free for everyone to use, and I would say it's one of the primary databases we use in health. So if I was, say, to do a very simple search, if I was just to put in, say, autism therapy, okay, so you can see here that it's, got over 14,000 results. That is obviously more results than I would want. But on here on the left-hand side, there is an article type. So you can see that one of these kind of filters that is set up allows me to limit it to. So I could say limit it to just systematic reviews. And then you can see on the screen here, filter applied systematic reviews. So I've gone from, I think it was 13,000 down to 381 results. And what I'm seeing now are all different types of systematic reviews related to different therapies for autism. So you can see a horse therapy or a mind-body therapy, another horse therapy. So there's lots of different ones, and you can keep it even broader. You could go to all types of reviews or say just meta-analyses built into it. So there's more variation. You can't necessarily go to, it doesn't have a type for, say, umbrella reviews or rapid reviews. You would have to do that a little bit differently. But I would say the big health databases, you are able to use a filter like that. So look around, they will be in different places. PubMed was on the left, and I included just kind of an image here so you can see what it looks like later on. And in Embase, which is another one of our big ones in health, it's kind of like a European version of PubMed. It has a lot of drug information and more non-North American material. They have limits built into it. If you kind of click on a button that says filters or limits, kind of just look around on the database that you're using, and you can see here that there are different ways that you can narrow it down to, say, just systematic reviews. So it really depends on how that specific database works. CINAHL is another database. Nursing systematic reviews are really big in nursing as well, and CINAHL is a database for nursing. It also has a lot of like allied health information, some social work information. So again, it has the ability to just kind of click a button and be narrowed down to systematic reviews. So you can see here, you can narrow it down based on publication type. So that's where that is going to kind of come in. For non kind of health questions, so I know that a lot of people are coming from like social work, peace and conflict studies, sociology, anthropology. Look around in your database, see if you can find something, but if not, you can always use keywords to narrow it down by adding in the specific review type that you are interested in. So what you can do is put in your topic. I would keep it as broad as possible, especially as you're getting familiar with an area, because there are not as many systematic reviews as there are primary studies. So you want to keep it kind of super broad. And then what you can do is put in things like the word systematic review or the word umbrella review. to narrow it down. So one thing that I would suggest though is, because when you do a search like that, so for example, let's see if I can show you here in Google Scholar, which I think all of us probably have used at some point or another. So here's Google Scholar. And of course, I always have trouble coming up with examples off the top of my head. So let's just say climate change communication. Okay. So what you could do here is then you could type in systematic review right after it. And what I've done is I have put systematic review in quotation marks that pushes those two words together, so it has to be found side by side like that. So here, what you're getting then are systematic reviews, but the word of the kind of the note of caution here is that anytime you search in a database using your review type as keywords as opposed to a publication type, it's looking kind of everywhere. So if an article just says, oh, you know, this is a primary study, but we have looked at systematic reviews, even though we are not one, that will be found. So you just have to be careful that you're actually looking at these bigger reviews. One way to kind of help with that is to make sure that in your kind of advanced search that you are searching the word, I'm just going to the Google Scholars advanced search here, is that you're searching in the title. And here, so here, if I narrow it down here, these words have to occur in the title as opposed to the words occurring, and here there's none in my example, but we can change that to say climate change, as opposed to kind of all of the text. And the reason is that when people have done a review of any kind, they're usually pretty proud of themselves. And so they want to have that in the title. We have done a systematic review. We've done a rapid review. We've done an umbrella review. They don't usually hide it. So by searching by the title, it's kind of a more efficient way for you to search. And usually people will indicate that pretty clearly in the title that that is what they have done. So that will work in Google Scholar. It will work in Scopus, if any of you use Scopus, Web of Science. It'll work in the library search as well. So try that out. So there are some tips here on how to do it. Okay, so before we go, I just wanted to kind of run a quick poll to see how people are feeling about this and if this has kind of changed the way that you have thought about reviews a little bit. So I'm going to run this one here. So based on kind of the session that you've just listened to, have you changed your mind about what kind of review you might want to do? I'll just go for just a few more seconds. Okay, so I'm going to close the poll. We had about 65% of you vote. And let me share the results here. Okay, so have you changed your mind about what kind of review you want to do? And 44% said yep, 34% no, and 22 not sure. So sometimes more education on a topic can be good. I think what often happens, especially with systematic reviews, is that people want to do them without kind of knowing everything that's involved. Okay, so let me end that one, and then I'm going to ask one more kind of follow-up question. Is what kind of review are you now considering? And I'll let you answer this because this is interesting for us as well to hear, you know, in the different disciplines, especially whether they might be considering something else. Okay, so I'm going to close this one as well and share those results. Okay, so from this, and again, for those who remembered kind of at the beginning, a lot of people were getting kind of standard lit review. So this is interesting as well that more people, the scoping and mapping review is of interest to a lot of people. So that's, I mean, that's what we're seeing in health as well. So this is interesting for us to see as well. Okay, so I'm going to hide those. So, and what I would, I'm going to ask you guys to hopefully do a little evaluation for us. But one thing I did want to point out is that next week on Wednesday as well, we have another session that we're offering that is called Getting Started with Systematic Reviews. And although obviously systematic reviews are the main focus, some of like the methodology that you would learn about in there and a lot of the steps would be very similar to scoping reviews or rapid reviews. So I would say if those are one of the ones you're considering as well, to think about attending. And the library, including NJM, obviously, we are working to get more of our sessions online. So we are going to be offering more sessions online. They'll be listed again on our homepage as well, probably in the same place where you found this one. And if there is specific kinds of content, please feel free to suggest it to us. And the other thing that I would note is that if you are coming from outside of the health sciences, is that, and you kind of want to know more about review types, is on the library homepage, there's an easy link to figure out who your liaison librarian is. So feel free to shoot them an email and just say, you know, you're interested in this, could they help you out? Do they have any suggestions? So we are here to help, even though things are closed down right now. And actually, Janet, maybe before I push people to evaluate, are there any questions that you think should be addressed?
Yeah, there's a couple. I threw them into the chat as well so that everyone can see them, but I'll read the first one out. So when conducting a review in the systematic review family, if you're supposed to incorporate gray literature, such as conference abstracts, what do you do if there's not enough information to determine if it satisfies outlined inclusion and exclusion criteria? That's a good question. You have thoughts, Maylin, or?
So I would say for like conference abstracts presentations, if you're not sure, what I often tell people is to contact the authors directly, because often if they've published that, then they may have more information that might not just be ready or is in peer review to get more information. I would say the reason you have inclusion and exclusion criteria is to help with that screening process. So if that conference abstract or conference poster can't answer your question, it doesn't meet the criteria. So you would have to leave it out unless you can get more information from the authors. But did you have a different perspective, Janet?
No, I think that's pretty much what I would say too. In terms of inclusion and exclusion, I'm thinking that you're talking about like if you can't tell who was included in the study, what patient part, like something about the patients. That is important. If you're talking about inclusion and exclusion criteria in terms of the type of article, gray literature is kind of exempt from that, right? So you're not talking about this has to be a cohort study. Obviously, you're looking at gray literature outside of those kinds of things. So there's sort of two different angles.
Right.
And we have one more question. So this person is asking what specific approaches or systems there are for each different types of reviews to make sure that they are reproducible, as you mentioned, i.e. what procedures we should follow. Is there any resource we can get to know this? So this sounds to me like you're talking about what kind of structures are needed for each of the review types. And that is depending on different reviews that you're working with. So when we talked about the systematic review process, there is a number of different methodologies that people can follow. So Cochrane Collaboration has one. The journal Joanna Briggs has one that's more nursing focused. There's when you're talking about scoping reviews, we mentioned the ARCSI and O'Malley. Those are the places that will lay out what the rules are, how you make your search and your whole project as transparent as possible. Any other comments, Malin?
Yeah, I would say one thing I like to recommend too is like the way you can learn what you need to do is to read other systematic reviews or read other scoping reviews and really see the methodology and to go, as you suggested, to the most reputable places. So not just kind of a random one you found, but to go to those high quality ones and see what kind of information did they capture. And I'm sure that the session next week is going to go through a little bit more about what kind of process you want to capture or what steps you want to take and what the process is, because especially in health, it's very clearly defined how to do it. And I think in the other areas, more methodology is emerging. It's a little bit more kind of flexible, but the more you read them, the more you'll kind of get a sense of that.
Okay, so it's 2 o'clock, but we have 2 more questions. So we'll keep talking, but if people have to go, that's fine. So the next question I have here is, gray literature is not always evident in reviews. What factors need to be considered when deciding whether or not to draw from the gray lit, and is it related to the type of review? Do you want to?
Yeah. Well, in terms of gray lit, to me, if I'm talking to researchers, whether we include it or not really depends on the question being asked and where we think that information is going to be published. So, if we know that their question draws on stuff that a lot of, say, government agencies would publish on, or I think usually, like if I pull from the health experience, anytime there's a public health question, that is frequently answered with the gray literature. So I would want to definitely look at and include it. If it was a question, so like I'm doing a question right now that is very much focused on, the efficacy of a specific drug in a clinical trial. So that stuff isn't going to show up in the gray literature as much. People are going to end up publishing that. It might show up as when they first post a clinical trial, but eventually it should end up in the published literature. So I think it really depends on the type of question. And I would say it doesn't as matter much for me on the type of review, but the question and where that information is being published. And if it's, like a new emerging area, then gray literature might be good because things might only be appearing in conference presentations, for example.
Yeah. And I think it's just important to be as transparent as possible in your paper, whether or not you're including gray lit. And if you have any specific reasons, like if you're concerned about time or if you think that there isn't going to be any valuable literature in the gray lit, then, at least lay it out, right? So your readers don't think you've just forgotten. Okay, and I think our last question for the afternoon is, for all types of reviews, do we always need to present our interpretation or perspective of the field?
I don't know quite what that question means.
I think it sounds to me like it's relating to, so when we were talking about like state-of-the-art reviews or more standard literature reviews, there's usually a perspective that the authors are coming from or interpreting the literature. And in the more systematic searches, in my opinion anyway, you're talking less about your opinion and more about the data that you're finding and your analysis of it and how you're analyzing it. So in some ways that is your opinion, but it's not as much just about me as a person, right? Does that make sense?
That makes sense to me. I don't know about the asker, but yeah. Okay, any other questions for?
Not at this point. There is just a reminder that the PowerPoint is in the first slide, but we will send it out by email to all the registrants as soon as we're done. And once we have a recording, I think we'll send that to the list as well once we decide where we're going to post it. Thanks everybody for coming.
Sorry, one more second before everybody departs. We did have the bit.ly link here to just evaluate the session, and again, it helps us to know what we're doing right, what we're doing wrong. So if you have a moment to fill that out, and we do draw some kind of gift card winner at the end of every term, so you have the chance to win that if you evaluate. And again, sorry, as Janet was probably saying, to contact us if you have any questions.
Yep, that's it. Thanks everyone.
Okay, thanks everybody. Bye.